Hi, my name is Jim Whitesel, and I am the former head athletic trainer with the Seattle Seahawks and have been in athletic training and sports medicine for over 45 years. One of the things I'd like to talk to you about is the use of laser in treatment of osteoarthritis, joint disease, and many other soft tissue problems. The laser is light, and light is a very, very healable source. It's a very, very non invasive way to treat an individual. And what it does is uses a superluminous red light to attract the laser into the joint or into the muscle cell and to activate the mitochondria inside the actual cell. And you've all heard of the mitochondria as being the energy booster inside the cell. And so if we energy boost this mitochondria, it allows the patient to have immediate pain relief and allows them to use the other musculature around the area to benefit them in what they do.
And then what effects would you say? I mean, how well does this work for something like osteoarthritis, and how well does it work for people that have really worn out knees and worn out hips
Yeah.
and backs
Yeah.
and
The laser itself works tremendously on people that have degenerative joints. The joints that become inoperable over time. It's wear and tear on the joints.
yeah, and you see that the even bone on bone can even have a great result when you're using the laser, because the laser light is actually able to penetrate through that tiny space. The light's so small that we can even get a good result with patients that are literally bone on bone, and people that want to avoid sometimes surgery and
Absolutely.
the how much better is it than shots and things like that that just mask the problem. This is actually getting the cells to replicate and heal damaged tissue, correct?
Correct. And what we always talk about in our profession, and Dr. Lyle loves to talk about in his profession, is prevention. And prevention and staving off further problems because of the laser light, it allows the joint to heal comfortably right away. And so that there's a lot less pressure being established to the weight-bearing surfaces of those joints.
And of course, though, depending on the level and severity of the condition, might take longer, and different people are going to need different levels of care and different numbers of visits and things like that. Some people can see some result right from the beginning, and some take time to continue to heal, depending on the level of damage. This is the laser that you used. With a lot of the pro athletes over the years, you used the laser and you saw great results with the Seattle Seahawks players and things like that.
Absolutely.
Yeah.
We see results right away.
Yeah.
Some type of result, whether it be, a low level result or maybe somebody that says, wow, I don't feel that pain. And when we couple that, with biomechanics, taking
sometimes
stress.
using a brace, and sometimes using some other devices to also help.
When you alter the stress to the extremity, to the lower extremity, you're not only altering stress to the foot and ankle, you're reducing stress to the shin, to the knee,
To the
the
hip,
hip,
to the
the low
back.
back.
Yeah, it helps.
So it's very, very helpful in all those respects when you combine that with the laser treatment, because it is just an immediate type of co-enhancement of the treatment.
Well, I really appreciate that, Jim. Thanks very much. I appreciate your taking the time to talk about the value of laser and how important it is, and because many people don't know that that's something that exists out there like this. They don't realize that there's something that's safe, that effective, to help get them to heal up and get these older and worn out joints to actually start to function better, to feel much better, to get out of pain. And someone like you that can give such a success story and testimonial to that technology is really helpful to people, so you're helping people by